Dozanin, welcome to our membership cafe. I am Tanea Watts, your membership coordinator. On the norm, we usually look at NADA as integrated with recovery of substance abuse. As time has gone on and people are providing NADA in all kinds of settings, bereavement support has become another setting where NADA is helpful in healing. And that is our topic today. In the summer 2020 guide points issue, Crystal Nielsen writes, I believe the NADA protocol is a powerful tool for bereavement support, and I would like to connect with practitioners who have employed it using needles and/or seeds and magnetic beads in grief support settings. But before I had read that article, I listened to Cheyenne Luzader, who inspired this cafe when she shared how she would like to hear more about how NADA can be integrated in grief support. Our next guest on the cafe today, and she is here today. Thank you, Cheyenne.
Hi.
Our next guests are coming from Denmark, Lars and Pia. Thank you so much for joining us.
Thank you.
Thank you.
Thank you. Can you hear me?
Yes.
Yeah,
All right. But just one more thing. Also, in the fall issue of Guide Points, Lars provided us with an article entitled Danish Hospice. And I don't know how to pronounce the name of your hospice. Is it Sydfyn?
It's called Hospice Sydfyn. It's southern Fyn. It's in southern island.
Okay,
then,
thank you.
Yeah.
And the rest of that title is Integrates NADA in its entire program. So before we discuss this topic though, I first need to take care of a little business. This cafe is held the third Wednesday of every month for about an hour long. This call is recorded and we will be editing it, and a YouTube link will be provided along with notes from the chat. This and previous cafes can be found on our website, accudetox.com, in the Member Resources tab. Today's cafe structure will follow this outline. Top of the hour, we will be hearing from our guest speakers, and then around the middle of the hour, we will answer questions and comments from all of you for our guest speakers or each other, and general discussion around the conversation. As some of our guests today English is not their typical first language, so please keep your questions for our office staff and for the middle of the hour. So if you would like to ask a question immediately, please direct message either Suni or Sarah. Can you guys give a wave or a hello or chair dance? Everyone can see you. And then if you would drop a note in the chat so everybody knows your name and that you're the one that they need to direct message, that'd be great. All right. And then the bottom of the hour, we will open the room for discussion that is not related to the topic. This can include website help or membership support or anything you would like to contribute, announcements from your community. All right, I'm the timekeeper and I'll let you know when the hour markers begin. And this is top of the hour. First, we will speak with Cheyenne, who has been an AccuDetox specialist since 2005. She is retired now, but she had worked as an addiction counselor since 1972 and entered a larger mental health picture in 1977. She has worked as a social worker and in hospice, holds a national certificate of grief, and this doesn't encompass all of who she is. Cheyenne, would you tell us where you are in the world and what was your catalyst for your honesty at our last virtual meeting?
Thank you. Hi, everybody. Can you all hear me okay?
Yeah.
Yes, okay, thank you. Yes, I am in Lewis, Delaware. That's about the, we're right on the crux of the Delaware Bay and the Atlantic Ocean. So I'm not, I'm only about a mile from the water. So it's a really nice place to be in the summer, not so good in the winter. And you've already heard a lot about my background. I've really been working for about 50 years in all of this kind of field. But in addition, I was an adjunct university professor But about 4 years ago, my husband and the love of my life for 57 years progressed in his Parkinson's and dementia to the point that I needed to retire from everything that I was doing and take care of him. I lost him about 17 months ago and discovered a side of grief that wasn't in the books. Nothing like I had felt in losing my parents or my friends. And it really knocked me for a loop. And then COVID came along and we all are suffering from the grief over the isolation and the effects of COVID in our lives. So the isolation further kept me from doing what I would have done, which is to really go out and get busy and get involved. So had a lot of time to myself, which I've never had in my life. If you look at my career, I never had time. So knowing that the 2020 holiday season was coming and that I wasn't in very good shape, I joined a support group. And that was really, really helpful for me. I was spent 17 weeks in a bereavement support group, not as the leader, but that I've been many times before, but certainly as the person receiving the benefits. And the thing that I was very aware of was how much other participants talked about drinking, that they really had increased their drinking. They were using it as a support, a very understandable, certainly to me. And I thought, oh, well, I can offer this to them. And then I discovered that no, I couldn't. I could no longer do needling. I had retired. I didn't work at an agency anymore. Our legislation does not allow us to use it in a private practice. So then I got mad. I got angry. And if any of you have ever been through this, you know that anger is a great catalyst. It really gets you, you don't have time to feel sorry for yourself. So first I started screaming to anybody who could hear about the legislation and thought, oh, well, what can I do? So I brought it up in a group. I got more active in NADA, actually, and started coming to more of the group sessions, and then brought up the fact that we really are missing the boat by not focusing on prevention more. As a counselor, I thought so often that if we did more with prevention, rehabilitation is so much harder than prevention. And the last 20 years of my career, I developed and ran a integrative medicine program at the hospital. And part of what we were trying to do was help our staff, our nurses and healthcare staff with stress and grief themselves. So we can really, I hope we can talk about ways we can expand into helping people with grief, helping prevention, and broaden our services to areas like hospices and support groups, caregivers, kind of a little different approach, because we hadn't, or at least my experience with NADA was we were working in already treatment centers, and actually that's what Delaware's legislation confines us to working in a treatment center. And while, like most of us know, so much easier to help people when the problem is just starting than to wait until it's really destroyed their lives. So I haven't asked anybody about anything. I haven't asked them about anything. I just let them talk in the group about alcohol, but I don't. I'm also a nicotine addiction counselor, so I didn't ask about how many people have gone back to smoking, but I would guess that's happening too. So, I spoke up, and I would really like to see some discussion. And I wanted to add something. I have discovered, I read a lot novels, and I have discovered a new item for us, and it is pencil eraser acupressure. So I can sit and read my novel and press Shin Min and very easily press the lung point, which I often find very, very sensitive, for a few minutes, and then switch hands and do the other one. So a new item to add to our repertoire is pencil eraser acupressure.
Sure.
Or watch television. You can do it. And you're trying it. I see you trying it, Suzanne. It fits right in, especially the lung point. It fits right, down at that kind of that little notch. It kind of goes right there. So
yeah, the acupressure.
I've been a part of the legislation from the beginning. We had 19 acupuncture detox folks back in the 80s and 90s. And then I can't remember exactly when, I think it was 2010, when legislation went in to license acupuncturists. We weren't licensed before. I mean, we just used it in our practice as counselors. So when acupuncturist licensing went through, they were the only ones allowed to use needles. So we could no longer practice and had to, it took a couple of years for us to find a way to get in and add a section for acupuncture detox specialists. And we finally did, but it's very narrow. We have to work in an addictions program. We can get a waiver, but we have to work only in a place where we have an acupuncturist or a medical doctor. So that's limited. I would like to, we did in 2017, when we tried to get this revised again, the most that we got expanded was to add the word prevention into the actual law. So we got that far, and anything else that we had asked for, we did not get. So at least the word prevention is in there. I would suggest that people, if in your state where prevention isn't in the law, then that be added. But I think that prevention and more freedom for AcuDetox people to practice, to have it in their private practice, or to practice without the supervision of an acupuncturist or a medical doctor, most of whom don't even know what we're doing. So
Okay. Well,
did I answer your question? I'm sorry.
You did. That's okay. We're at about quarter of the hour, so you did wonderful. Thank you so much, Cheyenne, and we really learned a lot. Thank you. Thank you, Lars. I wanted to let people know that that you can find, Lars is from Denmark, and you can find Denmark's NADA website on the international tab on AcuDetox.com. But hi, Lars, welcome.
Thank you. Thank you.
So why don't you begin and tell us a little bit about who you are and what is your role with NADA?
Sure. Well, yeah, who am I? I'm actually a nurse. And so I've been dealing with grief, almost all my life. And the first time I really experienced this, I was 16 years old. I went to visit my mother at the hospital. She was working there. And suddenly a nurse student said, well, you can put some clothing on, you can walk around with me, you can see what's happening. And suddenly I end up sitting with an old lady dying in my hands, and I was 16 years old. And it was a very special experience because I felt that I was not afraid. And then I said, well, perhaps I should become a nurse. So that was my way into that. And I never forgot that because it was a very beautiful situation, actually. So since then, I have paid special interest into that kind of work also. But as a nurse, I mainly worked as, and I've done that for many years, almost 40 years. I worked in psychiatry. I worked also with in prisons. I worked with detoxification, substance abuse, and all that. I've had a lot of different kinds of activities going on as a manager and training, teaching, nurse, and something like that. So a lot of things going on. And then many years ago, I became a licensed acupuncturist, and I was also head of a acupuncture TCM college in Denmark for many years. And when I was working at a psychiatric unit back in 1995, we started to work with benzodiazepine and other kind of drugs that we were actually trying to help our patients to get off. And we was the first place in Denmark ever to do that. And then it was very strange for most doctors at that time to do that. But we did it. And after 2 years in 1979, my superior doctor told me, well, perhaps you should have a look at this. And he showed me something about the NADA protocol. And I was a trained licensed acupuncturist, and I didn't know it actually. So we went to Sweden, we had some training, and we came back and we started to incorporate in 97 the NADA protocol at a psychiatric unit. And it was the first place that happened in Denmark ever. And from that point, it really took off because we saw it was helping a lot of patients with anxiety and a lot of psychiatric problems, of course. And then after 3 years, I went to the Lincoln Recovery Center and trained with Michael Smith. And then I became a trainer, and then it went really fast. So for 21 years, I've been training, and today I'm supervising all our trainers in Denmark. And we are a group of different trainers that go to different kind of places to work. And the reason why we do that is that the Danish legislation, you asked me about it, is quite easy to work with. So everyone in Denmark actually can do acupuncture. You don't have to be a doctor. You don't have to be a licensed acupuncturist. Of course, there's some rules about hygiene and other things, insurance and stuff, but you can do it. And in a working place, of course, the managers is in control, but anyone can do it. And you can do, you can do a lot of programs anywhere in the country, really. So what we did was I hired a lot of people to train, and I wanted people that was very good in different kinds of work, because the Danish National Health Board accept NADA and they accept recovery. So if, for instance, a psychiatric unit wants training, then we can send one who's used to work in that kind of field. If it's another kind of section, if it's a shelter, if it's social work, whatever comes up, we can send someone who knows the specialty. And that's one of the reasons why I think we've been growing so fast, because every time they book a training, someone comes that are very well educated in their own field. Because the key, I find, is that you have to implement the thing. You have to, it's a complementary method, of course, and it must work together with your daily work. So when we started to work in hospices, for instance, it's many years ago I did that. I have had a lot of patients dying, and have been using it in my own family also for that kind of of work. And but so it was not new to me. But 16 years ago, I was booked to do a training at a hospice. It was the first time. And what I did is I went up there and I found out that it was the doctors who actually hired me, because I also was a licensed acupuncturist. So they wanted a lot of special body points for different, symptoms. And we did that. But what I really wanted to do was not really that, because I saw we were somehow missing the point. We were almost as technical in our approach as the medical profession. And that was not what I really wanted to do. It was okay, of course, but I found we were missing the point. So my job was to open a door that was totally new. Talking about feelings and emotions and organs and stuff like that, it was totally new, because it was people there was from a medical profession. There might be some nuns, but still the doctors was in charge. So the key was actually to open their eyes to see we have a method here where you can work with medical issues, but you can also work with the spirit, and we cover both with a very simple protocol. I was very happy around 6 years ago when I was Hospice Sydfyn, where Pia is working. They took contact to me, and they wanted to start a program. And Pia can talk more about that in a few moments, how they're doing in details. So I will do the more in broader paint to speak. So I've been there twice training, and I think a colleague of mine called Nina, who also was in Delaware to a conference some years ago, and she's now dead. She was there 3 times. Actually, she was a patient at the same hospital. So while I was training there, it was quite a special situation. But Pia, she told me about they have something they call total pain. And I really like that because, and she can talk more about this, they talk about they have a physical, a mental, and a social, and a spiritual pain. And they work with all that combinations. And I think that NADA is a protocol that really covers it all in one simple model. So you don't get technical, you can be with the patient, you can be there and be present. And what I normally say is that what we normally train is that you have, of course, the 5 points. Time is very important. We say 45 minutes, sometimes more, to get better results. Because the 5 points, it's a full circle of life. And if you really are in grief, you need all the total DNA you've been building up and use for the whole life, emotionally, spiritually. You need it at that point when you're really in trouble, so to speak. So it's very important to use the 5 points. And we have 2 ways of doing it. You can work with, for instance, symptoms. You can have anxiety. You can have sleeping problems, a lot of different kinds of symptoms to work with. And if you do that, it's okay. But then normally twice a week, 3 times a week would be enough. But if you only have if you have less time, 2 weeks perhaps, and you really want to help people to go into process, be able to get the courage to let go, then you need many treatments in most cases. So for us, it's also important to say what you want to gain is important. It's not just setting the needles. It's of course important to do it when patients want it, but sometimes you need a strategy to get a really good result. And sometimes it's treatments every day, especially when we're talking about process. But I think I will give the word to Pia now, so she can talk about total pain or what they're doing and how they combine this beautiful, simple, and very profound method, of course, also a message sometimes, to the patients and to all of us, also to the staff members, and also to people who work as volunteers. They have a very beautiful program. Thank you.
Thank you, Lars.
You can always ask questions, of course. Yeah. Sure.
Okay. We will in a little bit. Let's hear from Pia first.
Yeah. Hi, I'm Pia, and I'm a nurse. Been working on the hospice for 8 years now. And we started, as Lars said, about 6 years ago, in training all nurses I think there's only about 5 that's not been trained in NADA. Our secretary, our leader, our physiotherapists. The head of the volunteers also is a NADA acupuncturist. So we are all covered, and we use it when people are admitted to the hospital. We have a folder that says we use NADA, and even our doctors, because in Denmark, it's quite opposite, I can hear, because in Denmark, the doctors don't often use acupuncture. It's more the nurses who wanted to do it. So it was all the nurses who came and say, can we please use this as a tool in our box here in hospice? So, and now our lead doctor is also telling about it when people are admitted to the hospice. Okay, maybe you should have NADA when you come to, if they have sleeping problems, anxiety, a lot of thoughts going in the mind when you're in that state of your life. Often your head is full of thoughts, and I see it as a head going like this. Yeah, and it really helps and puts the thoughts to the boxes where they need to be. So there's places for the what's it called? The thoughts that's needed to be considered with. Do you understand that?
Yes.
Yeah. So we offer whenever I see a head that seems like it's going like that, I offer NADA, and I often say, I don't think you should. I would even ask you. I would just say, sit down and take these needles, and see what it does for you. Mm. And quite often, it's the right thing to do. It's as well as the way I see people. And if they are bad sleepers, we offer it as instead of a sleeping pill. And that's, wow. Yeah, and often at the moment we have a couple who's admitted that it's the man who's sick, and they're both at the hospice. And every night they're both getting NADA to get through the nights, and they're quite, if we don't have the time, if there's stress in the ward, and we can't get the NADA. And it's really so important for them. And I see it's just as important as they get the good night's sleep as the process they're going through as a couple, because they're very symbiotic and can't live without each other. So I really hope it's a way for her to get through this grief. Mm-hmm. Yeah. Did you want to say something?
Oh, I was going to ask, how do you present NADA in your hospice? Like, is it something that people know before they come, or when they arrive? Okay.
No, I present it as a secret tool, because a secret weapon to get through with something. And I had an old man. His wife was sick, and he was wandering up and down, and he didn't feel very well. And I said, oh, could I please come with an offer? And I tried to present those needles. No, thank you. I don't like needles. Well, then I thought I could get through maybe with the seeds. They call seeds.
Yeah. Seeds or beads, magnetic beads.
And okay, and then he came back next day. What did you do to me? Because when he came home, he had this calm and peace, and just went to sleep and at night, instead of going home and hoover the whole house. A few days later, when his wife were worse in her condition, he said, okay, now you can find your needles. And then he came to me several times, and every time he wasn't feeling well, could you please come with the needles again? So I think it does something. It does something really good, and makes them at peace, and makes them more confident being in the process of letting go.
So you offer beads as well?
Yes, we do.
Mm-hmm. Do you,
Some of our relatives have troubles being in the house. Sometimes it hurts too much to be there, and so they find every excuse for not using 45 minutes sitting with the needles. And then I need to use the beads instead of as a way through to them.
okay.
Yeah.
Oh, that's beautiful. Yeah.
Yeah, actually, it is really works sometimes, and they find this peace, and yeah, it's magical. I had
Okay.
a woman, she had, unfortunately, she had this extremely loss in her life. So first she lost her 40-year-old son, and a few months later she lost her husband, and her life stopped completely. She didn't sleep at night. Every night she went to sleep, she was crying. She woke up next morning saying, how do I get through this day? And then I met her and say, okay, have you heard about Nada? No, she hadn't. Could I please help you? I came to her once and treated her, and she got her life back. It was totally magic. And of course I continued and fulfilled the whole treatment, and she really gained her life again.
Oh,
So, yeah.
that's
And
beautiful.
as I say, I do understand why people who don't believe in Nada, why they say, oh, yeah, well, but because it's so magic sometimes when we see those things where people totally they reach themselves again. I will. Yeah.
Mhm.
Mm.
Oh,
Can
thank you
I
for
say
sharing.
something?
Yeah.
Can I
Yeah.
say something? Yeah, thank you.
Yes.
Pia, I think you're also very good at making Nada visible. You have flyers, you have it on you have the screen, the television screen. You have a lot of you do it. I mean, it's very visible the very minute you pass the door. So I think that's important too. You do a very good job there. And I would like you to say something about delirium, if you feel like.
Yeah. A lot of our patients, up to about, I think 80% of our patients catch a certain point of delirium in the way to the death, and we use a lot of medicine in that case, diazepam kind of drugs, and haloperidol, if you know that. Are you doctors?
I'm not a doctor.
No, it doesn't matter. But
We do have some doctors.
try to ease that delirium, and sometimes we just don't get through with it, and we have often experienced that we put on a lot of. Our first choice is often the medicine, because that's our, it's just in our DNA as nurses and doctors, and we're not that. It's not that we're using Nada as a first choice every time, but trying to sometimes, because we can see the difference. And sometimes when we don't get through with this medicine, say, have you tried the needles? And when we put on needles, and we always use Yentang as well. I know it's not in the Nada protocol, but we use it as an extra point, and so helpful. And then often we put people to sleep that way,
Wow.
and maybe just for 10 minutes. But when they have been awake for 24 hours and we can't get them to lay down, and when we can put needles in them, maybe just with 3 main needles, and then Yentang, then they get some rest in the body, and that's really impressive.
Yeah. Thank you. We are currently at the middle of the hour, and so this is the time that we open up questions from our attendees to you. And Ruth Ackerman asks, when you offer beads, do you do the 5 points for the beads or just the Shenmen?
Did you ask me?
Okay.
Who did
Who
he
do you
ask?
Yeah, Pia.
Okay, no,
Or-
often it's just at the Cheyenne and the reverse.
Okay.
Yeah.
And
Great.
how about you, Lars?
Hello.
You also, hi, yes, so glad
Hi.
to see you. Same thing, do you do the Shen Men just one bead point or only needling?
Well, normally we do the NATA protocol with needles, and then I advise people sometimes to use the bead in between because I find that's most effective. And so normally we train people in just using the Shen Men and the Shen Men reverse always on both ears, because you have two hemispheres that should work together. And it works very well. You really don't need a lot of points, I think. Too many beads, magnetic, could get interaction with each other. And I think it's very easy for people to press the right button, so to speak, the right point. They're more focused. So the more they put several beads on, I think they start thinking about, oh, I should treat this and I should treat that, instead of just being focused and grounding. And the Shen Men gets also the kidney. So it's very powerful. So normally we don't mix it up, and we try to stay as clean as possible, so people are not experimenting too much.
May I just add one more thing? My husband, who died in August of Alzheimer's, had dementia. At one point, when he was really confused and agitated, I was able to put a bead on him on reverse Shen Men. And he said it was like someone turned on the lights. He had relief for a while. And then once he went into memory care, I wasn't able to access that or do anything. But
Wow.
this is very encouraging to hear, actually.
Yeah.
Oh, and one more question. I'm sorry to hog the questions, but do you treat the whole family before COVID? Were you able to treat the whole family as well as the staff, as well as the patient?
Yeah, we do it, and we do it as well now.
Mm-hmm.
We're quite at hospice because people are at the end of their life. We are allowed to let in people and their relatives, so we treat them as well.
Very good. Thank you.
Yeah.
Does anybody, does any of the family go out and do you find that have they given you feedback about NATA?
Yeah,
Have you
definitely,
received it?
definitely. Yeah.
Yeah.
And actually, we started an NATA cafe in the town because we want to have a follow up to the relatives when the patient were dead, and then they had some place to go.
I think I read in the Guide Points article that you also provide NATA at the cafe too, don't you?
Yeah, but that is closed because of COVID.
Okay, yeah, sure.
Unfortunately, yeah.
Now, and this might seem like kind of maybe a petty question, but it's a question that I receive a lot being the membership coordinator, but do you charge for any of those, or is it all covered within the hospital?
At hospice, it's peanuts.
Oh, right.
It doesn't cost anything, and at the NATA cafe, we only take for the needles.
Oh, yeah. Okay. Yeah.
Something like I'll think about $3, I think. We'll charge.
Yeah. Okay, great. Thank you, Pia.
You're welcome.
And about, I guess, the other thing that I really enjoyed reading about in the article was that even the kitchen staff is also trained to provide NATA, and I thought that was great.
Yeah, but everyone can actually access when we open for training. Yeah, and if they're not trained, then they can just come. So they use us as well.
Yeah.
Yeah.
All right. Was there any other questions from our participants today, or comments that you have?
This is Sophia. Can you hear me?
Yes.
Yeah.
Hi.
Good morning,
Hi,
everybody.
Sophia.
Good morning. So I have questions about funding, and I think this applies to our speakers as well as the people who are present. Last week, we were able to present the program that I presented on for the NADA conference. And we did our work in community, as you know, and in the prisons, and had really great success, over 200% enrollment, reaching over 96% of the historically underserved. And so the program was well recognized here in Colorado. And we were able to present for Denver Health. Denver Health has treats over 500,000 patients a year of the underserved. So that's a large group of people. And so I'm listening to all of these stories, and they've said, you know, we used to have retreats. For the last 15 years, we've been promoting auricular medicine and culturally based care. And then once I got trained with NADA, I realized that although I had trained with stones and seeds and other methods in Mexico and other parts of the world, the NADA needles, as many of you have said, they just work magic. They go into the mind, body, spirit so beautifully. And so my question to all of you is, we have this opportunity to go into the Western healthcare model. And so I'd like to reach out to all of you, because what they're asking for are examples in other states, in other parts of the world where this has been successful. And we all know that it's cost effective. Someone just said it costs $3. You know, so we know we can make a big difference. And someone else was talking about prevention. You know, let's prevent this instead of really focusing on rehab when there's so much more pain, and trying to correct and to go back and heal years of pain. So my question to all of you, and I would be happy to put my email there, is that's what I'm looking for. I'm looking for support, because right now the door is open for Denver Health. We've had staff members, doctors come and receive the NADA and in a culturally based care setting, like what I talked about for the NADA conference. So we have a lot of supporters right now saying, let's do this. So how do we move this forward? And to me, it opens a pathway for NADA because Denver Health is a large organization, 11 community clinics. So I'm putting that out there. The question is, how have you gotten support, especially, you know, the funding? We're a federally funded clinic. So there's a lot moving forward, but the door is open for NADA right now. So I'll give you my email, and anyone that's willing to support me in this pilot project to move forward. This is exciting to be able to say, you know what, yes, bring NADA into the clinics, and what does that look like? And as many of you, as we've discussed before, the culturally based care piece, they've agreed to that. There's not a separation. They recognize the beauty of the indigenous component. So that's being invited into the clinics as well.
Yeah, that's cool. Thank you, Sophia. That's a great news. And please do drop your email in the chat there, and we'll make sure when we send out the YouTube link, we'll also include that in there.
We'll hear from Ruth.
Yeah.
Just two thoughts. And in doing this program development, the thing that made all the difference in the world was people having published, and whatever the equivalent is now, their work, so that when we go to the agency or we begin to enlist funds, that there's some kind of documentation that this has been done successfully, because the anecdotal stuff never went anywhere with people who were not already enrolled. You know, they knew about NADA. Those people were easy. Unless they were working in a setting and saw the magic right in front of them, it was very difficult to access without other people's testimony. That's why those original articles in 1987 and 89 on alcoholism and NADA protocol were so instrumental in any funding we ever got in the States. And that brings me to my other question. Lars, have you guys written about this at all? Is there any literature that I can refer to when I move forward here in my community?
Well, if you talk about studies in Denmark, in general, the answer is no. We have several articles in nurses magazines and stuff like that.
Yeah,
but not scientific. some people have done it or tried to do it, but in most cases it was not really serious, and it was, sorry to say, not to offend anybody, but it was doctors who was not knowing what they were really doing, and so it was really shit, so to speak.
Right.
So and I was enrolled in a huge project only a year ago, but it was stopped by political reasons. It was actually showing very good results at a hospital, and suddenly the management stopped it. So it's a very sensitive political issue, I think. But I know right now that one of the universities in Denmark are going to do a huge study, and I am in contact with them, and I hope it will be a good protocol, and then they will think it in a way that is the NATO way of thinking. So it's not just a medical tool. Yeah. So I think we will come up with something, but it's a very, very, it's a long journey, of course, but something is on the way. And but what we have is smaller documentation, a lot of anecdotal stuff, of course, but many working places are doing some kind of reports, and we will try to publish them on our website. And we are changing the website actually, and we also have movies coming up, and we have movies with Pia from the hospice, and a lot of that is coming. So you can also inspire people by showing movies with people working, where they're telling what they're doing. What we see in the daily life is that it's really also working. I know some people only will go for some kind of numbers, but if you can show people that this makes sense, it's always open some doors, I think.
And as far as guide points is concerned, even a report of this meeting written in guide points becomes a reference point for me going to hospice. And also, I'm very aware of how difficult research on this stuff is, but the outcome research from the data from a program, if that's a little more available, that would be great too.
We're working on it, but we are not there yet.
Yeah, thank you.
And the difficulties about the difficulties about research in our field in palliation is that the people dies.
Yeah, there's the outcome.
That really is a problem.
I know,
because we often do things slightly different than in hospitals, because we're doing what the patients feel are working. So if it's contrary to what the protocol says, then we do it anyway. So we just often we just treating people, patients, what they feel working. Is that, do you understand that?
Yes, I do. Thank you very much. Yeah.
Okay, we do have a question from Avani Dilger. How do you work with situations when patients are afraid of needles?
Then
I'd love to, can I add a little bit to, can I add something to the question? So we are using AccuDetox in a prevention intervention program for teens. And we just had a flurry of overdose fentanyl deaths in our community among young people. And so we actually work with grief of the friends who are left behind young people. And they come to us and we do AccuDetox, and it's been wonderful. But what I notice sometimes is that we also work with teens who are transitioning out of homelessness, so who come off the streets in a harm reduction model in Boulder, Colorado. And what I see sometimes is the people who carry the most trauma, that they're afraid of needles. And of course we work, suggesting beads and all of it. I'm just curious what other practitioners do, because I often see that the people who would need it the most, who are so traumatized that they sometimes probably have a fear of having anything changed. That's my sense, right? That people just hold themselves so frozen. Where sometimes I think that would be the best, would be not a protocol. And then I see a resistance or a hesitancy. And I'm just curious, because I can imagine I worked in hospice, and so I know exactly what you're talking about with the delirium. And so I'm just curious how you work with that.
yeah, it's a problem. It's a great problem. And then I use the beads, and actually I don't have any other suggestions. No.
This is Sophia. I would like to share with you what happened with us in one of our programs. We worked with re-entry folks that were coming out of Lyman prison and other areas. And after having been in such a violent and rough environment, I was really surprised that so many people were afraid of the needles. And so oftentimes I would say, you know, if you're willing to try one, we start with the seeds. And then I'd say, if you're willing to try one next week, if you're willing to try two, and we would slowly get people up to the 5 needles, but they felt like they had control and they could feel, you know, they could process the fear of having 1 needle graduating to 2 to 3 to 4 to 5. And sometimes it took us like a couple months before we got 5 needles into someone's ear, but they felt like control. And then after that, they were comfortable and they were moving forward.
Okay.
Thank you, Sophia. And Victoria Taylor shares, I find that if they sit in a treatment one time without needles, they want it the next time they come in. Thank you so much, everyone. All right, and we are at the bottom of the hour. And at this time, we share announcements or we talk about other things. But before we do, I would like to share a Mike Smith quote from his writing, Spirituality and Serenity Prayer. Mike writes, acupuncture can take the most panicked person and show them a peaceful side of themselves in about 30 seconds. You are able to reveal this important human and spiritual lesson right away. There's nothing in the needle, so there must be something good in me. Something good, something peaceful, something quiet, something forgiving, something optimistic. All right, is there any final comments? And then we will have announcements. No? All right. Well,
I just
would
needed
like
to hold some space, I think.
Oh, okay.
That was nice.
Yeah, that's it. Oh, thanks, Sarah. Did you have any questions, Sarah, or any comments?
No, I was very moved by all the sharing from Cheyenne and Lars and Pia, and just I don't know, I could feel myself in the space that you are in and how you were sharing the work that you do. I felt each of you did such a beautiful job bringing us to you and bringing us into your experience. And I just feel emotional in a very kind of kind and positive way. I feel really appreciative of what you shared. Thank you.
Thank you, Sarah. All right, so in this last 5 minutes, I would like to say that our next cafe is going to be April 21st, and we are going to be talking about starting a program. And I'm hoping that Ruth Ackerman can be there to share her wonderful insights. Please, Ruth.
Tanea just popped the question. You better say yes, Ruth. I'm just kidding.
I say, why not? Okay.
We rely on Ruth so much, and we appreciate all your insights and everything you share. Okay, and I also would like to take a moment to thank Lars and Pia for taking time out of your day to join us for this very important cafe that I think is really important for us right now, globally as well.
Yeah.
So.
Good.
Thank you, Tania.
Yeah.
Thank you.
Oh, thank you. All right, and
Appreciate
then
the global span. I love that we're being, you know, with technology, doing the global thing. It's really great.
yes, it is. Very much so. And I can't remember if we have any other NADA announcements right now. Do you know, Sarah or Suni?
Yes. We would like to invite everybody to an event that we are hosting next Friday, March 26th. And it's the launching of a series that we're going to be holding in the coming year on NADA's history before NADA became an organization and moving into its conceptualization and founding. So next Friday, there is going to be a conversation with two historians. Johanna Fernandez is one guest, and she wrote The History of the Young Lords. And then the second guest is going to be Mickey Melendez, who was one of the founders of Lincoln Detox and also had written a book about a history of the Young Lords prior to Johanna Fernandez's book, which is much more recent, just came out, I think, a year ago. And the conversation will be moderated by yet another historian, Ina Meng, who has made some films through the Harvard Asia Center about the early revolutionary history of the NADA protocol. So we're hoping to host a dialogue around the history every couple of months. So this is the first one in that series. And it's going to be held at 10 a.m. Pacific time, 11 a.m. Mountain time, 12 p.m. Central, 1 p.m. Eastern. You can't say you didn't know what time it was because I just gave you all the times. 6 p.m. Central European time. Anyways, we want you to be there is what I'm trying to say. It's going to be an hour and a half. And we're really excited for this series, and we're excited to be exploring this history. And the framing of this conversation is really about setting the stage historically, what was happening in the moment, historical moment of the late 60s and 1970 that led to the takeover of Lincoln Hospital in the South Bronx. Why did that happen? How could that have happened? What were the political and social forces at play that led to that event, which was really sort of the founding moment that kind of paved the way towards connecting with acupuncture several years later. So please join us for that. And that is all that I wanted to share.
All right. Thank you so much. And it's now the end of the hour. And thank you everyone for joining us for this cafe. And we'll see you in the future.
Yep. Bye-bye.
Thank you.
Bye. Thank you.
Bye.